First thing with the new contract is that it will remove the effective safeguards for how long we've worked in any given week. So essentially stopping hospitals from making you work quite long hours for long periods of time, that will go. And so we could return back to the 1990s where you had quite tired doctors working very long hours, and ultimately that's unsafe for patients. There does need to be a big conversation about how we're going to fund the NHS and social care for the next 4 years, for the next 10 years. But targeting junior doctors is not the way to go about this, and it will actually end up costing the NHS more in the future. This junior doctor contract doesn't save the NHS a great deal of money, and really you need to look at other areas of the NHS for where you can actually spend money on prevention, on public health. When you've got quite long hours, in London you also have to deal with things such as the tube strike, having to find alternative ways of getting to work, often at short notice on weekends. That is quite difficult in itself. With this new contract, where there won't be significant safeguards to stop us working long hours, you could see yourself staying much longer at work and then trying to make it home in the early hours of the morning. It's going to make it very difficult for people with, say, childcare in London, who are having to work on evenings and weekends, finding childcare at very short notice sometimes. It's going to make it very difficult for them to continue to be able to live and work in London. And so you'll potentially see junior doctors choosing not to continue to live in London.